This is Damian and McNamara with Elsevier Global Medical News, and I'm here at the Perspectives in Rheumatic Diseases meeting in Fort Lauderdale, along with Dr. Kenneth Gordon, who is a dermatologist at Northwestern University and in North Shore University's Health Systems in Evanston, Illinois. Dr. Gordon, thank you for being with us.
Thank you.
And one of the you're a dermatologist at this rheumatology and dermatology meeting. One of the things I want to ask you about is what kind of perspective you're bringing as a dermatologist to psoriasis and why it's important for you to be speaking also to rheumatologists.
Well, there is an overlap between rheumatology and dermatology, particularly in psoriatic disease with psoriasis and psoriatic arthritis. And there are many things that the rheumatologists are not particularly aware of that are changing in the world of psoriasis that is going to be important for people to know in the future. So, for example, the medications that are used for psoriatic arthritis and rheumatoid arthritis have not yet been proven in psoriasis. And so people who have assumed that there's an overlap in medications, things like tocilizumab or golimumab have not been tried to a great extent in psoriasis yet. On the other side of that, there are new medications for psoriasis that are very, very promising for that disease. Medications like ustekinumab, which will hopefully be approved by the FDA in the next few months, that will allow us to treat psoriasis and might have a varying effect in psoriatic arthritis, things that are not proven. But they're medications that rheumatologists who have patients with psoriasis and psoriatic arthritis are going to be seeing and they need to be aware of.
Right, and is it the case where you'll obviously see the patients first in a lot of cases as a dermatologist, but then there will be aspects that you want the rheumatologist to address as well?
Yes, there's no question that the great majority of cases of psoriatic arthritis will show up in the dermatologist's office first because of their skin disease. And because the skin disease very frequently, in the majority of cases, will appear before the joint disease. That said, that management of psoriatic arthritis is a thing that needs to be coordinated between the dermatologist and rheumatologist. And a rheumatologist is going to need to understand what the skin doctor is doing, just as we're going to have to send the patient to the rheumatologist to really understand what that individual is going to need for care of the joints.
Anytime you're talking about two specialties kind of collaborating on the same patient, is there any sort of turf battle involved on who handles what? Or?
It's interesting because I think that in many cases the turf battles are not realistic and not something that has to take place. Clearly there are people who feel that biologics should be in the spectrum of the rheumatologist, and the dermatologists are neophytes in this area. And our side of it is that most of the patients, their skin disease is actually just as bad, if not worse, than the joint disease and their perspective on how it affects their lives. And so we're going to be the primary doctors involved. I've had a long history of working with a number of rheumatologists, both at my institution and others, where we've pretty much shown that there's no need for a turf battle on anything, and cooperation is the best way. In fact, I've worked in the past in having a joint, no pun intended, clinic between dermatology and rheumatology where we saw patients together. In fact, that was the best way to see patients because in terms of the patients understand that the doctors are cooperating and are communicating well because we're obviously in the same room. And secondly, and I thought it was great, I learned a lot, and I think my rheumatology colleagues learned a lot. Working with each other just in the room and the banter that went back and forth really, I think, helped our education and better treated our patients who weren't seen and assist our patients who weren't being seen within the context of our clinic.
I need to ask you about disclosure because you mentioned some of the agents that are in development or something like that. Can you tell me what you're developing?
I've received research support from Abbott, Centocor, Amgen, and have been a consultant to the same companies. I'm not a member of any speakers bureaus.
Okay. Thank you very much. This has been Damian McNamara with Elsevier Global Medical News speaking with Dr. Kenneth Gordon at the Perspectives in Rheumatic Diseases meeting in Fort Lauderdale. Thank you very much.
Thank you.